Meet Taliso. She's a mother living in the Gedo province of Somalia, and she is 26 years old. Gedo province is a rural region of Somalia, and the total population in Gedo provinces is about 3.2 million. Most individuals live on about $1.36 per day. They are primarily living on agriculture and shipping industry.
Taliso has 4 children, and she's in her 3rd trimester with her 5th child. She knows about contraceptives, but does not have enough information on their proper use.
This is all part of Somalia's unmet need for family planning, or the amount of women who would like to delay childbearing, but are currently not using any contraceptive methods. Taliso would have to walk 4 hours to get prenatal health care and access to family planning services and contraceptives.
This is because this part of Somalia is considered a medical access desert, meaning the region is more than 60 minutes away from the nearest acute care hospital. The current TFR in Gedo province is 6.27. Maternal mortality is the 3rd highest in the world at 732 deaths per 100,000 live births. The current population is over 12 million people as of the start of 2019. Looking at a population pyramid, we can see a sizable portion of the demographic being their youth, and poses a high youth dependency ratio. 0.02 physicians per 1,000 capita, and Somalia has one of the lowest pharmacies per capita in the world.
This is why we created the Sunrise Project, or Somalia's unmet need for regular, integrated sexual education. Relative to Somalia's medical infrastructure, there's a strong educational infrastructure with schools distributed throughout the rural regions of Gedo. We aim to establish satellite medical clinics with an emphasis on reproductive health and education and existing educational infrastructure in the region. These clinics will help bridge the gap between the lack of education on contraceptive use and the lack of access. This is similar to a school's in-house nurse, but extended to meet unmet needs. Because there are so few local doctors in Somalia, we want to identify and connect international doctors with local doctors. International doctors work alongside local doctors to push modern contraceptive methods. This training will enable Somalian doctors in Gedo to be more self-sufficient in the field of medicine as more local doctors are brought into the program.
We can also work with local health educators in colleges and universities to establish formal partnership programs. These educational initiatives will foster an environment in which children see medicine as career opportunities. A positive byproduct of satellite clinics in schools is enhanced educational norms. By giving children additional resources to visit educational institutions, we hope that proximity will encourage attendance among school-aged children. Linked to those effects, placing clinics in schools brings more people, especially women and girls who are not regularly attending schools, into those environments. By centralizing care for communities and local community spaces, we can implement and practice family medicine. It is important to engage Muslim leaders in Gedo province that will aid in destigmatizing contraception. Close to 99% of the population practices Islam, and because the religion generally allows for most contraceptives to be used, the religious leaders will be crucial in informing their congregation about current contraceptive methods. By establishing local clinics, we can provide immediate care to children in a community. In order to maintain the longevity of the program, we must recruit additional doctors. After this, we can expand to new areas, eliminating other medical access deserts.
We've spent the last 4 months listening to the local Somali women. Somalia has a total of 622 doctors across the country, and the Gedo region has a number of 3 hospitals. On average, women in Somalia walk 4 hours just to see a doctor. We want to make practitioners more accessible and reduce the distance women need to travel by partnering up with schools that can serve as health centers. The Sunrise Project intends to reduce the number of unintended pregnancies, unsafe abortions, and the number of women and children dying due to birth complications in the Gedo province, and eventually expand across Somalia. After implementing our pilot program, Taliso now only has to walk 30 minutes to receive medical care in the same location her children attend school. The Somalian government has shown interest in funding family planning, and now your contributions can play a pivotal role in the lives of Somali women and be a ray of hope for their futures. We are
The Sunrise Project.